So I thought it would be interesting for you to just start off by telling me how did you land in the fire service? What's your a little bit about your background? How did you end up in this crazy job in this crazy world?
Yeah, I appreciate you asking that. It's a funny story. I grew up in Southern Nevada. I was born and raised in Las Vegas. When I was 10 years old, I was bored over the summer. My cousin, who was a photojournalist, taught me how to work a camera. And of course, a fully manual film camera back in
Yeah.
the day taught me how to work a camera, and I became quite the photography enthusiast. And when I was going through high school, I worked, I was on the yearbook and the newspaper and did this kind of stuff. In my summer job, I was a freelance photographer for our local newspaper, the Las Vegas Review Journal.
Oh, that's. Do you remember what kind of camera you had? Do you remember
I
what
had
you?
an Nikon N2000.
See, I love it.
And so I graduated high school. I had gone back to the newspaper for that summer looking for summer work as a freelance photographer, and was told that they had hired one of the other photographer's sons to do some of their freelance. Didn't think there would be enough work for me. And so I was discouraged at the time, but I had turned to student employment services at UNLV, where
Uh
I
huh.
was an undergraduate at the time. And up there, posted on the wall, was an opportunity to be an intern, a management intern for the Clark County Fire Department in Southern Nevada. At the time, I was looking for a career in federal law enforcement. I wanted to be in the FBI. And the story on how I really wanted to do that was when I was a photographer. I went and shot a breaking news story of a bank robbery
Ah.
in downtown Las Vegas. And holding the Polaroid in his hand was this FBI agent, and I just thought he was 10 feet tall and bulletproof. I thought that looked like the coolest job on earth. He's going to
No
go capture
doubt.
that guy. And so I told myself I want to be a federal agent, and I'm going to go to school, and this is what I'm going to do. And so I'm in student employment services, and on the wall is this opportunity as a research intern with the Clark County Fire Department. I said, well, it's not federal, it's local, and it's not law enforcement, it's the fire service, but this sounds like a great opportunity. I interviewed with their staff, and they hired me on to be their intern. I ended up spending 2 years with the Clark County Fire Department. I worked on extraordinary projects with them, including their accreditation
Wow.
work. And this is back in 1998, 99, early 2000. And before accreditation was really as big as it was today, I worked on a lot of that. And the exposure that it gave me as an intern to the inner workings of a fire department are just absolutely extraordinary. So I learned the kind of the business of the fire department long before I ever spent a day in field operations. I had a mentor, a guy named Scott Maxey was a mentor of mine. He was a firefighter who worked on special assignment in the administration. Took me on my first ride-alongs in the fire station. The first time the tones went off when I was at that fire station down on the strip in Las Vegas changed my life forever.
I can hardly imagine.
I can remember it like it was yesterday when the tones went off, and came back to that fire station and said, "This has got to be the coolest job on earth." The look on people's face when that fire engine turned the corner and made their way onto that property. The call was at Circus in Nevada, and the building had been evacuated, and the folks that were evacuated broke out into applause as the fire engine was showing up, lights and sirens. They were going to
That doesn't
see.
happen to FBI agents. Just so you know.
It does not. It turns out that doesn't happen. Nobody cheered on the FBI agent, and I was so moved by this. These folks, they didn't know what the problem was, and they didn't know the capabilities of these firefighters. But boy, at that moment in time, the relief they had on their face as somebody was going to be there to make a difference for the problem that they were up against. To me, I thought, gosh, there cannot be anything more rewarding to spend my life doing than to be able to serve people in that capacity. Got back to the station, told this mentor, this buddy, that I wanted to pursue a career. He helped me get enrolled in EMT school. I started EMT school while I was going to college right away, and started testing for the local fire departments. I was blessed to be offered a job by the city of Las Vegas Fire Department in October of
Yep.
2000, And that's what started me on my journey in the fire service.
And you that's that as someone who left my street position in 1988, that's a pretty short time period to go from starting a gig to what you were able to get to in Las Vegas, and then being chief of your own department. So what's the secret to the meteoric rise?
Oh, well, and I appreciate you framing it that way. It's been a great career, and I've had so much great opportunities to do the different positions and serve in the different roles that I had. One of my commitments and why I got into this business in the first place, as I just shared that story with you, is I wanted to make it a difference. I wanted to make things better for the people who visited the community or who lived in the community, and the people who worked for the organization. And I wanted to do whatever I could or had in my power to be able to make that better. And so I had a passion for serving the job all the way, still do to this day, because to me it was more than just fighting fires, or I was a paramedic too, so doing the paramedicine. It was connecting with people who had a need and trying to help find a resolution to them because they had trust in me or in our industry, our fire industry. There's trust and responsibility. Those are the two values that I feel like I always have to talk about. The community trusts we're going to provide the service. We have a responsibility to be mentally prepared, physically prepared, have the right training and the right attitude to do that. Now, as a chief officer, do we have the right policies and the right equipment and the right decision-making capacity in our folks to make good judgments when they're out in the field? That's how I've really guided myself. So as the organization said, hey, we need somebody to look at how our EMS supplies are arranged in our bag and how we deploy those, I'd raise my hand and said, I want to help do that. I want to help do that project. I joined as many committees as my time would allow me to. I took advantage of opportunities the organization had for continuing education. I was on part of the labor union's executive board, and we got to work on solving problems for the community or for the organization to help make things better. And I wanted to be a paramedic, so I went to paramedic school in the first a few years when I was able to do so. In the organization, they sponsored me to go to paramedic school. We were very blessed in that organization to have that opportunity. I know not all firefighters have the ability to get a sort of a scholarship and get it sponsored by our agency to do that. It was afforded to me, and I was grateful to the community and the organization for that. I spent 9 years in that position as a firefighter paramedic, and I altered between a transport unit and a fire engine every other day. I worked with the same crew for that whole 9 years. It was just a great experience. A couple changes, I should say. Mostly the same folks. I had the same partners that I had worked with. It was just such a great experience. I don't know that I was ever going to leave that. We worked in an inner city station in Las Vegas, and I was perfectly happy doing all of those things. And then I reached an interesting point in my career, and it was the idea of whether I wanted to test for captain or not, or stay in the position that I was in. And you started to see, and you probably recall this maybe from your career, you start to see other people who are ascending to other positions of responsibility or authority in the organization, and you start asking yourself, I don't know that I could ever be as good as insert person here. The mentors that I had that were my officers who I thought hung the moon, and I saw what a great job they did. They had this sixth sense and an intuition that I could never imagine. And I grew up, working under these great leaders, saying I could never be as good as them. And then I'd see other folks, come up, and I said, but I probably am, I'm for sure better than that one, and then that one. And then it really started to get me thinking, and I started thinking about these other folks who are doing these positions that I didn't think were making the best decisions for the community or for the organization. And I thought, if I wanted to make a difference now, this was what my next step needed to be. I needed to put myself where I could make those decisions and impact at least the calls I go to with the crew that I work with. And some wisdom was then also imparted upon me that those folks who I thought hung the moon, who were these superior fire officers, was shared with me and says, they really weren't that good on day one. Probably not even that good on day two. And it took them a while before they were probably that good, and that was some really important wisdom I needed to hear, because I was trying to compare myself on what I could be to somebody who had already proven themselves at that level. So I built up the courage. I took the exam. I scored really well and was blessed with the opportunity to serve as a captain. And when I was a captain, I worked in the downtown fire station in Las Vegas. It was like a assessment center every day in that environment.
Absolutely.
There were 22 folks assigned to that fire station. There were 3 different captains on different shifts. We had the battalion chief assigned in our station, 2 fire engines, a ladder truck, and 3 rescue ambulances, all running out of the same firehouse.
I've been to that firehouse. I know what it's like.
You've seen it then. And so you name it, the different types of challenges, personnel matters, and issues that we were up against. I had a chance to experience it, to work through it, to navigate conflict amongst different shifts or amongst the different thoughts that we had as captains, and be able to do a great deal of problem solving through coordination and collaboration. And I mention all of that because these are skills that end up being quite valuable in the stage of my life and in my career now. And so how the next parts of the story goes is our organization was going through a leadership change. We had a new fire chief that was coming into the organization he came from San Jose, Fire Chief Willie McDonald. He's still the fire chief in Las Vegas now. And he just really embodied a professional fire chief to me. And he came into our organization and worked, I think, it was impressive to watch him come in as an outside fire chief into an organization that at this stage had a bit of a history now of promoting mostly internal folks. For the last few fire chiefs had all been internal promotions. To bring someone from the outside, I think to some extent our organization was hungry for this. This is in about 2011, I think we're in now, when maybe about 2012 is when the new fire chief had I made captain in 2012. This was about 13 then, 2013. He comes in, new fire chief, and he does an audit and assessment of his administrative team, his administration, and outbounds that he's going to be promoting for an assistant chief position in EMS. They were looking for an EMS chief, a position that had not been filled for a great deal of time. I was very, very involved in the EMS program in Southern Nevada, in Las Vegas. Worked connected, was part of the EMS committee for at least a decade, worked very closely with our medical director and with our staff. So if there was an area of specialty, people would probably put EMS on me, which is a hazmat or, tech rescue, those kinds of things. I was an EMS focused guy. And when there was an opportunity to be the EMS chief, I really had to think about whether it was a good time in my life to do that. I wasn't burned out. You hear some horror stories of people who leave the fire suppression world, leave the operations ranks and go into administration, and then they hate it or they move to the shifts. Keeping in mind, I left college and went into the fire service working 24-hour shifts. So I was one of those who didn't sort of have the regular job. I wasn't sure what I could expect, but a lot of great mentorship, a lot of great leadership of folks that were around me that I took the time to visit with and really reflect on opportunities and what I hoped to be able to do, and getting back to that personal mission on why I got in the fire service in the first place. And just to also be frank, I was a little bit bored as a fire captain. I didn't get to be as involved in as many calls as I did when I was on the ambulance, running medical calls on our rescue units. It was a much slower, pace than I was ready, comfortable with. And I thought, maybe this is a good spot. I mentioned education. I'm a big believer in formal education. I took advantage of a great deal of opportunities. So at this stage, I had earned a master's degree in public administration. I had really well prepared myself to be an administrator if I wanted to. Right. A lot of folks always, they say, well, you always wanted to be the chief. I said, no, I never wanted to be told I wasn't qualified for a position. So
it's that's a different mindset, right?
Right. Yeah. I wanted to make sure that if there was ever a position in the organization or in the community that I would want to know that I did the best I could to be qualified for that. And that would give me the chance to decide if it was a job I wanted or not, and not somebody else to decide and say, yeah, sounds good, but you're not qualified. So I had spent a lot of time preparing myself so that I could be qualified and be able to serve in that capacity and be effective. And so I applied against 19 other internal candidates from our organization, and was chosen to be the EMS chief. At the same time, they made another promotion to be the operations chief. Assistant chief in Las Vegas is a 3 bugle chief, so third down. And it was a fantastic transition for me. I loved every second of being an administrator. It's a fantastic job. The things that I've had the opportunity there to be able to influence are things I'll be proud of for life. To substantially be able to influence the service delivery from that capacity. I mean, at the end of the day, there is only one EMS chief in that organization, and I was proud at the time that it got to be me.
Yeah.
I trusted myself to be able to lead my friends and my colleagues with integrity, and I had done that. While I was serving in that role, the position evolved, as most administrative positions do. Sometimes It's by punishment, sometimes it's because you've done extraordinary things, and most of the time you don't really know the difference between the two. Is you're upsetting me, or is it because I'm doing things well, but I got more responsibility added to my plate? The position was then redefined to be over the operational support, and so I transitioned to same position, assistant chief, but now I was responsible for not just EMS, but training, logistics, health and wellness, and the 911 communications center. And I have to say, having that connection with the 911 communications center has got to be one of the best experiences that I ever had in my profession. The folks that work in a 911 call center, the 911 dispatchers, are some of the most extraordinary professionals.
Boy, isn't that the case?
Yeah, they just do, absolutely exceptional work. It's a high stress position all the time. There's very little closure for folks that work in that profession. They have to be on you don't know every single time that phone buzzes what type of experience you're going to have on the other end. And then by the end of the 5 minutes or however long, 2-3 minutes, you're on the phone call, and maybe the fire engine shows up or the ambulance shows up, and they disconnect, and they don't know what happened.
And then they're right on to the next one without the downtime to wait for a patient to be unloaded at the hospital or to get back in service. They don't get those little breaks built into their day.
You're spot on, and I recognized that early, and so my hat's off, and I have just such admiration for folks that are in that profession. It also taught me that we aren't doing operations right. I learned quickly that as in a fire service, agency, if your operations aren't fully coordinated with your 911 center, you are missing opportunities to run your organization more effectively, more efficiently, and serve your community better. The call starts when the event happens, and I would even argue that the call starts before it happens with really effective risk reduction and prevention method.
I like that systems thinking approach.
Yeah, absolutely. And so if we can start to connect, certainly well before, from a pre-planning standpoint and from a risk reduction standpoint, before events happen, that's the responsible thing to do. Our community expects it of us. Then you move it forward when an event occurs, and as soon as that call is entered into the 911 system, systems go at that point. directions to community responders, the immediate responder. Do they know CPR? Do they know where the closest AED is? Are there AEDs there? Should we have put one there a week ago? That kind of stuff. But those are, without spelling it all out, those are elements where the 911 dispatch center is an absolute partner to the fire agency. They're providing all of the details and coaching of folks who are on scene while the emergency responders are getting themselves put together and just deploying themselves out to that space. I mean, it just takes a village to make all of that stuff come together to be able to make a difference in just one outcome, and it's just absolutely worth it. And until I had a chance to put on the headset myself and get in front of a dispatch computer and answer 911 calls, it didn't become clear to me. And once I got to do that, I was certified. To be fair, I got certified as an emergency medical dispatcher. They taught me how to type into the computer, which is really hard to do, to talk and type and listen all at the same time. And my life again changed in recognizing that we could implement and do things differently in the operations of our organizations, our agencies, and service delivery to our community if we just communicated better. With our dispatch environment, a lot of folks, they treat their dispatch like they're a service provider for them, like we're a subscriber to your service. And I just tell folks that when I hear that, you're just looking at it all wrong. And these are first response folks who are absolute integral to your organization. So I was blessed to be able to do that and learn that opportunity, that experience, and was great. The organization was great. The folks that I got to work for got to make a really big difference. I was born and raised in Las Vegas. At this stage, I had done a great deal of time there. The way that the Nevada pension system works is you're able to purchase service credit when you're a vested member of the pension system. You could purchase some years. So I was fortunate enough to be able to do that earlier in my career. And so in the pension system, I had 20 years of service.
Wow.
And which was a benchmark for being able to retire without penalty. I don't collect. I'm not of age to collect. So you have to have time and then age to be able to collect, or you collect with penalty. So my wife and I, got to thinking about what it would look like if we left Las Vegas. And she was super, super supportive. She was born and raised in Wyoming. She had moved to Vancouver, Washington, to go to school. She moved from Washington to Las Vegas, where she had been a number of years before we had met and got married. We both had been married before. So our second marriages, we were set up by a mutual friend who was a firefighter in Las Vegas. And that's a funny story about, how she decided that we should be together, and she was right. So we talked quite a bit about, what does this type of an adventure look like? I'm completely risk averse. I don't know if you could glean that or not. I was totally risk averse. Like I was all about the comfort zone.
So that statement does not jive with the stories that you've described so far. You're just telling it.
You wouldn't have told, yeah. So you wouldn't have gleaned that.
No. I'm suspect of that self-assessment. Just so you know.
That's probably fair. I definitely was comfortable in Las Vegas, where I was born and raised, and where I went to school, at UNLV, and then was still living at home when I, got hired into the fire department, at that stage of my life. But at this point, it was looking at a big move. My mom and my dad and my brother left Las Vegas about 12 years ago. They moved to the coast in Oregon. They moved to Newport, Oregon. My parents moved there first, and then my brother moved there about a year or two after them. He had done a couple trips to visit, said it's super green, it's really pretty, I'm moving to Oregon. So he left, he met his wife there, and so I didn't have any family left in Las Vegas. My wife's family lives in Wyoming. She's got a brother that lives in Florida. But other than our friends, there wasn't anything that really kept us there. Sure. And so, my parents who are getting older and aren't in great health, I decided that this was if I was ever going to take a look at leaving this organization and maybe starting a career in our life together somewhere else, now's the time to do it. Because if I would have stayed much longer from a pension standpoint, it would have made sense for me to stay, all the way. Right now, I'm at a point where there's still enough runway in front of me to work, for terms of working, that I can make a good career coming to this state.
Yeah.
So we decided, let's explore and let's see, and would anybody even be interested in me? And it's kind of a funny story, because I was really looking for a good deputy chief job. Like, is there a good number two person that I'd be a really good number two for another fire chief who a strong leader, and I get things done, and my systems approach, like that's what I thought. And so I was looking at jobs. I had applied for jobs. I had gotten opportunities to interview for positions. And this job here at Jackson County Fire District 3, that flyer sat on my desk for a little while before I made a decision. I didn't know a great deal about Southern Oregon. I knew the coast. I knew the Portland area, but I didn't know Southern Oregon. But I just kept going back to it, and something about the organization, something about the values and the mission just sang to me, and I thought, let's see what this is about. Applied. I spoke with the recruiter at length, and took the opportunity to come out and compete for the fire chief position. It was I was treated very well here. It was just an extraordinarily organized operation. The process was really professional, and it just, all of that sang to me about what a great organization this was. And as I shared through this process what my philosophies were, and what I had accomplished, or what my vision for the organization or the industry, or how I think critically or get things done.
Sure.
They kept were interested more and more and more. And there other folks were certainly qualified, and many of which more qualified than I was. They had been successful fire chiefs in good organizations. I was an assistant chief looking to make a step up, but there was something about this organization that there was fit. It's a young organization with a lot of energy in the firefighters. We're a smaller combination operation. We have 4 engines with 3-person staffing on shift in a day, and a battalion chief. So we have less people on duty in this agency than I did in the downtown fire station in Las Vegas.
Right. For your whole department, right?
Yeah, and I loved every second of that. By the time I was thinking about leaving Las Vegas, I had lost track of people's names. There was 2 or 3 rookie schools of people I'd never seen or heard of before. There was about 700 employees in that place, and it wasn't connected. And the idea to come work for a community and an organization where not only would I know their names, but their spouses' names and their kids' names, and
right.
be able to be a fire chief who's really integrated in the organization at that level was important to me. And to be part of a community that it felt like a community. And Las Vegas did when I grew up there. I actually grew up in Henderson. But it's grown and it's evolved and it's different. And I thought, if I had this chance to move to this organization of such great professionalism, with such ambition to do great, amazing things, and to live in a community where you felt like you were part of the fabric of the community, this wasn't an opportunity that was going to pass up.
That's that's about 3-4 years ago now.
It's 3 years ago. Yeah. Yep. This June of 17 is when I moved. When we moved here, and when we moved in May, it started in June, and it's been. It's just fantastic.
So, within your thinking and framework, part of what brought us to the conversation today is your integration of data and kind of data-oriented thinking into your leadership style and your systems thinking and approach to things. So I'd love to hear a little bit about, how has data fit in and informing you as a leader over the years and today, and that kind of thing.
Yeah, I've spent a great deal of time, studying management, performance management, public administration. I've done Six Sigma type stuff and learned about process engineering. So data has been a component of my thinking for a long time. I spend a lot of time, either studying or even speaking on elements of decision making and the variability between line suppression, fire officer type decision making. What the psychologist Daniel Kahneman, if you've read any Kahneman, is
Thinking Fast and Slow. I love his stuff.
Thank you. Yes. So thinking fast and slow. So system one, system two, decision making. The administrator, the executive leader, really needs to operate and drive into the system two space. And so we pride ourselves on taking a real strong effort at creating the right decision environment. So we talk about how we are going to look at problems and make decisions before we're in the space to make decisions. What data do we need to inform ourselves of these discussions? And when I first came to Fire District 3, I was able to walk right into the beginning of a new strategic planning session. It was a community-driven strategic planning session. We brought in a consultant to come help us navigate that. And one of the big components that came is about what type of information or data systems do we have? What kind of data, what data do we need to be able to drive really strong decisions?
Yep.
And where are the gaps? Where do we need to be able to fill those gaps? I have this quote. I'm going to grab this for you. Let's put it in front of this came out of Moneyball for Government. Can you read that okay?
Yes. Right now it's like we're playing T-ball in a sand lot. We don't keep score. We don't know what inning it is, but everybody still gets a trophy. What we need is a professional stadium with facilities, umpires, and analytical leadership necessary to perform at the highest levels. I love that.
Yeah, this moved me when I read that book, so I printed it out. It sits on my desk, and I share that with a lot of folks on my staff, because that's how I believe. Like the fire service, bless our hearts, we're really stuck in a lot of this is how we've always done it. This is how my intuition, this is how I feel. It's never served me wrong, and we humorously are sort of quick, we're sort of evolving into this, and then we hang this data-driven approach, and we're starting to use data systems and analytics. And we're really proud of ourselves, and I think we should be. I think as a fire service, we are coming a long way from where we had been a decade ago. But I do have to humor for a second, going all the way back to my initial career desire in law enforcement. Our law enforcement counterparts have been doing this for over 50 years.
Absolutely true. Absolutely true. So let's to just think about kind of a specific example of how to think about data. This virus has transformed our entire world. Grocery shopping and going to school and employment stability and the risk of ending up sick or ending up on a ventilator and slowly suffocating to death. It is shaken up basically everything you can think of across the entire planet. And when you think about, trying to care for your community and the people on your department and thinking about, so what do I need to track? What do I need to use to maybe predict things in the future or deal with things right now? Tell me about how you think about that.
Yeah, so I had a lot of experience with First Watch when I was back with Las Vegas. And so I had an opportunity to see what a lot of its capabilities were, and amongst other software systems that we had used, but we really were in tune with what capabilities of the First Watch platform was able to go. So I had that in my mind when I moved here to Oregon. And before COVID, and it was probably about, I'd say maybe 2 months ago, maybe 3 months, before COVID, so 5 to 6 months ago, we were organizing a local emergency planning committee, a LEPC, which is a byproduct of the EPA's community right to know law.
Yep.
And our public health officials were there at the meeting, and I had been introduced to one of the public health leaders. One of them I work with on some EMS projects here in our local community, but I had connected with one of the other public health managers. And I asked questions about surveillance over the 911 system.
Right.
And it was a great dialogue over it. I shared my experience with First Watch from Las Vegas and shared with her even at the time that I was a little concerned that we didn't have any surveillance in our 911 system over Jackson County. And she had shared with me they have a product, and I don't remember what it was called, but it was a system that was integrated as part of the hospital's emergency room, piece.
Okay.
And I told her, I said, well, that's great. I'm glad we, at least in this community, we have something, but I would like to talk to you more about putting surveillance into our 911 emergency response system, because many times that's going to be the early indicator that something is a problem in our community. And, let's talk about it. So fast forward to your question is COVID starts to emerge. And the very first meeting that we had brought together the leadership from hospital systems, from the EMS systems, the fire agencies, had come together with public health. This was before they banned us coming together, and we were learning about the disease. We had a case of COVID-19 positive, travel related, I believe at the time. No community spread, but we were starting to plan and talk about what needed to happen. And the question was, what do we need? And it was imperative at that moment. I relayed to the entire group that we need to have a surveillance tool in our 911 system that's monitoring all the traffic that's coming through our system. We needed to scan for surge in call volumes. We needed to be scanning for symptoms related to COVID-19. We needed to be scanning for high-risk facilities like nursing homes, care facilities,
jail facilities,
highly populated spaces. We don't have that tool. We could have spread and we wouldn't know. We need that tool immediately. And then the other piece that I had said was we need to have plans to put a physician, a medical professional into our 911 center, so that when we reach a surge and we don't have enough ambulances or first response vehicles to manage the volume, we're able to have a medical practitioner make decisions over the phone and over the radio. We pair them with a command officer to decide who's going to calls and who isn't. Who are we gonna stage calls for later resources? In addition to that, we needed to be able to have some trace back opportunity for, again, we didn't know a lot about the disease at the time, but what we knew was that it had the opportunity to spread from asymptomatic folks, that we were worried that we could end up with entire fire stations that needed quarantine. In a response community like ours, that we're population collectively in this valley of about 250,000 folks. We don't have a great deal of emergency response resources when compared to a metropolitan city.
Sure.
And our next, Klamath County's 1.5 hours, 2 hours away. Roseburg's 2 hours away. So we've got a lot of work to do in a narrow space for us to get things done. And so preserving what emergency resources that we had, we wanted to do that. But we knew, again, with a data-driven mindset, we knew that it had to be deliberate and it had to be informed decisions. That it wasn't going to be okay to just say, well, let's not go to certain low priority type calls, or let's just not send fire units to calls and just send ambulances to calls. Like those to me are hasty decisions that are made in an uninformed fashion. And
a lot of those decisions have been made across the country.
I agree. I think those decisions do get made a lot, and that isn't the way that I wanted to approach this, and the way that we had spoken with our other fire service leaders. And one of our initiatives, we organized really quickly. I forgot to mention that the fire agencies and our EMS ambulance partners organized early. We're used to that, through command structures. When there's events that are coming, we start to get ourselves put together. And we were able to do that and help while our county was getting themselves organized. We had ourselves put together as a fire and emergency medical services, so that we could make sure that we were communicating really well and we had consistency across our organizations. And so we talked about our approach and one of our objectives was we were to continue to serve our community. We were going to manage all the calls. And that was really important for me. It was important for my elected bodies, but all the elected body that were represented with their fire service leaders in the room, is saying, we're not going to turn our back on the call. We're going to manage it. And that managing it might mean we're not responding to unit, and we might get one later, but it's going to be a deliberate decision that we make related to that call. We are going to make an informed decision about that's responsible to the community on how we want to manage the calls for service that come in during this COVID time. There have been lots of calls that we have not sent first response units to. That was part of our reducing exposure goals to emergency responders, and it was part of preserving PPE, which was another one of the initiatives that our state had said is, we don't know how long the PPE will last. Odds are you will run out. Preserve it as long as you can. And that got us to being more innovative in our approach. You know, we empowered our command officers responding to calls, so that when they were able to and it was appropriate, that they could call a patient, call them on the phone, call them on FaceTime, get them to text you back, you know, on your phone. All our units have phones assigned to them. Let's be creative. It doesn't always have to be the same. And they embraced that when they were able to. Certain call conditions that were met through the ProQA system that we use in our dispatch center, it indicated that it was a patient that would be a probability of success utilizing outreach that way. And our crews would call and they would connect with patients. And many times we were able to provide them comfort, and we were able to speak and communicate with them on the phone, conducting an assessment that way until an ambulance arrived on scene, if an ambulance was appropriate. We were also able to, and we implemented into our system, an actual direct call referral. So patients who are meeting symptoms of COVID-19, where an ambulance would be started to those calls, and the patient would be routed directly into a nurse triage telemedicine system set up by our hospital partners. So many patients at this point, not 911 related, were coached through public messaging to say, if you're feeling, you know, a sore throat, fever, this, you know, chills, flu symptoms, we want you to call the hotline, talk to the nurse, they'll route you through to the telemedicine. You can talk with a provider. Most likely the best solution is going to be shelter in place, essentially stay at home. We'll order you a test. We had a drive-through testing facility, and they would go back. They go back home and wait results for the doctor. We couldn't have implemented these programs and these directions, if you will. I mean, we call them just basically operational directives. We wouldn't have been able to do that without having an absolute quality assurance tool for us to know that we were doing that responsibly, and it was informed. So that's where First Watch came into play for us. We knew that this was a data system that we were able to connect with and be able to answer those questions that we had. I reached out to Terry Fitch early on. In fact, I had conversations with Terry well before COVID, talking about what does it look like if we brought First Watch to Jackson County, Oregon.
Sure.
And one of the things that I think I shared this a little bit earlier in our dialogue, with a community like ours, there's about 12 different fire agencies that serve this population. We have rural fire districts that are all volunteer. We have combinations, urban fire department. We're just a big swath area of lots of different smaller fire departments. And mine that I shared with you of our four career stations, 4 volunteer stations, is considered one of the larger fire districts in the state of Oregon. So it just lets you know how small some of these agencies are. So our power is in our unity, in our collaboration. Totally. Programs like these, many of our agencies don't have the budgets to be able to support them all on our own. Notwithstanding that, it also sometimes doesn't make sense if just this area of the region does it, when we know that there could be a benefit for a larger one. So these conversations I had with Terry early on, share with me what it looks like if we had first watch in Jackson County. Let me talk with the other fire chiefs and see if I can drum up some interest and share my philosophy, like we had talked about data-driven decision making and how we can be smarter in how we're doing operations in coordination and partnership with our 911 center, who does do the dispatching for the entire valley. So COVID breaks. I have this conversation with the public health officials that we need a surveillance tool on it. I immediately put in a request through our emergency manager's office for the First Watch tool based on a quote that Terry had shared with me. And we, sort of waited. But the part I want to say is, I think I reached out and he and I had some back and forth. What if we wrote it like this? What does this look like? Include this, but not that. And, figuring out what was the right system for our community right now. Yep. How could we get it done? And our organization, we know that the bureaucracy in getting some of that funding, we know it takes time.
Normally, sure.
And I knew we didn't have time. We knew that I knew that we needed to have this surveillance tool in play right now. I didn't feel like we had weeks to get it implemented, because our community, our responders were at risk, and we needed to be able to make informed decisions about how we were going to respond folks to calls. We anticipated surge. We anticipated resource drawdowns due to unavailability for quarantine. We had to have informed decision making better than what we had at the time. I also anticipated that it would take 3 weeks, 30 days to implement a system like that. Anybody who's implemented any kind of technology knows what we're talking about. It takes a great deal of time to onboard. Terry and I had shared some conversations, and I said, you know what, send me the deal. I'll talk to my board of directors, which I did. My board of directors supported us using funding from our organization and our capital contingency to get the contract written, and we'll get it sorted out on the other end. So I'm grateful for our board of directors, our community, and our organization for their willingness to put forward the steps that we needed to get this thing going in the entire county. I felt strongly enough that I wanted to go ask them to make this commitment, and we will get the money back. We'll get some support. It's an important tool for us, but I'm not worried about that. I'm worried about making sure we have the right tool to make the decisions that we did to be able to support our firefighters and our community, and the board agreed with that. I penned that agreement, that contract with First Watch, sent that by scan message back over to Terry on Monday. Data was flowing into the First Watch tool by Wednesday. Wow. I've never heard, it was unheard of. it was unheard of when I looked up, saw that message, and came back from the First Watch team that your data is flowing, have a look at it, and let's start building the triggers that you need. By the way, we've already programmed in the protocol 36 and the COVID-19 stuff that's been, pretty common across the fire service and the industry. Those that are First Watch customers, they've already kind of paved the way for what we knew we were going to need. In addition to that, we had built some other triggers that were really locally defined. So we call it an IDX risk patient. So somebody who didn't qualify for ProQA's protocol 36, but had symptoms that we were concerned about, that we wanted to wear additional PPE on.
And you look at the symptom list for COVID right now, and it's hard to find something that's not on the list. Right?
It's hard to find something that's not on the list. So we had protocol 36 patients that were extracted based on certain acuity levels or certain conditions were dispatched differently. And then we had other calls that had IDX risk. So there was a patient that we were suspected was sick with COVID-19 that would inform our officers on the best approach. Sometimes it was wear all the PPE and go in and make contact. Sometimes it was go in by phone. Sometimes it was one person with PPE, and they would make a determination, call the rest of the team. There was a lot of flexibility with our officers, our captains on the engines, to be able to exercise judgment on the call. We were able to use the information that First Watch was capturing in the system to provide quality assurance to the decisions we were making in terms of response. In addition to that, the tools was shared and up at the Emergency Communications Center that Jackson County Emergency Operations had operating. They were watching the trends in the 911 system, so they were able to see over time if we were seeing where our surges were at, times a day that our surges were at. All, obviously all tools that First Watch provided to inform our policymakers at that level, public health, emergency, the IC for the county's Emergency Operations Center was seeing, the sheriff were all able to see real-time information that was going through the system. How many patients were COVID suspected? How many patients were not? When we knew that from a response standpoint, we really treated every patient as if they were COVID. But from a public health hospital system and what's our capacity to manage, knowing which patients were symptomatic or not would be important. Other things that we, like we mentioned earlier, that we wanted to monitor was if multiple calls to an address, the high risk facilities, that if we saw multiple 911 calls in a given time frame occurring at one of our high risk facilities, a nursing home, that we felt that would be a necessary alert to public health.
Sure.
That we think there could be an issue, and that it at least deserves somebody to take a look at it. It could be different ambulance crews or different shifts that go there. They may not have realized there was multiple calls that had happened to that facility in a given time frame. First Watch doesn't let that through the cracks. Right. It captures it, it sends the alert, it gets us the idea to look into it, because the solution public health may have wanted to do was move medical practitioners to that facility instead of moving people out one at a time to an emergency room. Maybe we need to bring the doctors to that facility because it's already spread through there. So that's another example of what we had programmed First Watch in our system to monitor, to help inform our decisions in our system as we were, sort of all learning about COVID-19 at the same time.
That's absolutely wonderful, and I'm so grateful for your willingness to make the time, and you're certainly an example of kind of and no disparaging to fire chiefs in other parts of the world or before you, but somebody who's really expanded your education and your learning and your thinking, and have brought a much more scientific and educated and well-informed, kind of thoughtful approach to the whole art and science of taking care of your community and taking care of your team in the process. It's really a fun story to extract from you. And I know we're getting close to the end of our time together, but I have one curiosity. It's clear to me that you are we probably share this, that you're kind of a perpetual student, and that you're always curious and learning something. So I'm interested if you have thoughts about what is it you hope to learn next. What's your next line of inquiry for yourself? I spend a lot of time around that researching now in behavioral economics and collaborative governance, collaborative networks. Wow. I
believe behavior, number one, we know is a huge predictor, and if you've read Kahneman, you know exactly what I'm talking about, on how we're going to be able to help navigate people towards setting up a better solution for themselves. So tools like we're in a wildland urban interface, and we have challenges of folks who are creating the defensible space, and how do we navigate folks to set them up for success using those kinds of tools to be able to modify, not necessarily modify the behavior, but allow them to be successful in their environment, and getting past what we think are their perceptual barriers for why they're not creating defensible space. And so we ask our community those questions, and we've guided them through some of our home assessment tools, and we're doing debris cleanups in our community now, things we never had thought about before. The public education message always was, let me inform you, and therefore you will. And we just know that's not in fact true. It's not that there are all of these various heuristics that impact our decision making. So education isn't the solution; it's coming up with some of these other solutions. And then the other thing is that we won't ever solve these complex problems we face as an industry if we're operating in silos. Interdisciplinary approach, collaborative approach to all of these complex problems is the only way that we're going to be able to get through some of these challenges that we've been facing for decades and decades. Obviously, technology is one of those. Integrating technology into our world, into our space, to help guide our decision making, so that we don't look at problems through one lens anymore. We look at it through multiple lenses, and our doctors have done this. There's interdisciplinary approaches to medicine. Where behavioral economics emerged is elements of psychology with
Sure.
economics, with neuroscience, with sociology, in a different lens to come in and look at problems. And so if we start to look at progress through interdisciplinary problem solving and not trying to find what box does that land in, so that the way we used to do it solves the problem, I think we're gonna get far. I think we're gonna get far. And so that answers the question of like, where do I spend
where do you
my
go next?
time studying? It's trying to figure out how do we get into spaces where we're solving problems that have been around for decades with new, innovative, collaborative, and interdisciplinary solutions.
I love it. Thank you so much.
Yeah, thank you.